Diagnosis of bronchial asthma. How can we diagnose the bronchial asthma? जो एक कंडीशन है bronchial asthma, it can be diagnosed clinically with presenting features. या हम इसको diagnose करते हैं by taking history of illness. History of illness. It can be diagnosed by taking history of illness, especially allergy infections, foreign body aspirations, and physical examination. And physical examination must be done thoroughly with auscultation of chest sinus. By physical examination, most commonly जो इसमें हम क्या देखते हैं, जो child होता है that presents with a recurrent attacks of wheezing. That presents with a recurrent attacks of wheezing. Usually wheezing क्या होती है, as you know, it is a sound prolonged. It's a sound, but the sound is prolonged, whistling sound. Prolonged whistling sound. ये कहाँ पे होती है? At the mouth. During expiration. This must be noted. Also, another test is by we can diagnose the condition. There are also different investigations that are used to diagnose the underlying cause and severity of the condition. These include pulmonary function test, absolute eosinophil count, chest X-ray, and allergy test. That is allergy test, that is skin test, and RAST, R-A-S-T. By these we can diagnose the bronchial asthma. Bronchial asthma जो एक condition है, it can be diagnosed clinically with the presenting features, mostly by taking history of illness, especially इनकी हिस्ट्री में भी होती है allergic infections और foreign body aspirations होते हैं. Also by physical examination we can also diagnose the condition, but physical examination जो है that must be done thoroughly with auscultation of chest sinus. जो इसमें important findings होते हैं physical examination में वो ये है कि जो child है that presents with recurrent attacks of wheezing. In addition to these, there are different investigations done to find out the cause of bronchial asthma and to also diagnose the bronchial asthma. जो इसमें investigations करते हैं these include pulmonary function test, absolute eosinophil count, chest X-ray and allergy test. Allergy test में mostly क्या किया जाता है, skin test किया जाता है and RAST. RAST stands for radio allergosorbent test. By these, bronchial asthma is diagnosed. After diagnosis, treatment is started. Treatment of bronchial asthma. जो एक child होता है जिसमें ये bronchial asthma हुआ होता है, that should be managed therapeutically for the prevention of acute attacks and maximum control of symptoms along with the maintenance of growth and development. इसमें हम क्या लेते हैं medications chest physiotherapy, exercise, counseling, avoidance of allergens and irritants are important aspects of management. But first you will see the drug therapy, जो इसमें ड्रग थेरेपी यूज की जाती है, या हम बोल सकते हैं जो इसमें मेडिकल मैनेजमेंट है। व्हाट इज द मेडिकल मैनेजमेंट ऑफ ब्रोंकियल अस्थमा? ब्रोंकियल अस्थमा के लिए कौन सा मेडिकल मैनेजमेंट किया जाता है? माइल्ड ट्रंक्लाइजर्स, mild tranquilizers are used. Tranquilizers इसलिए यूज किए जाते हैं to remove anxiety and emotional distress. Tranquilizers यूज किए जाते हैं to remove anxiety and emotional stress. Also, expectorants. Expectorants are used to remove excessive secretion. Antibiotics are also prescribed. Antibiotics are also prescribed to treat infections. Oxygen therapy. Another point is the oxygen therapy. Oxygen therapy जो है, it is used in severe distress and when the child is having cyanosis. IV fluid therapy. IV fluid therapy is given for the maintenance of fluid electrolyte balance and to correct the metabolic acidosis. In addition to this, comfortable proper position or sitting position is given to the patient to relieve from respiratory distress. To relieve from respiratory distress. Other drugs भी इसमें दिए जाते हैं, but anticholinergics इसमें भी दिए जाते हैं, but these are the main drugs जो इसमें दिए जाते हैं. फर्स्ट इसमें क्या दिए जाते हैं? ट्रंकुलाइजर्स में यूज किए जाते हैं किस लिए? फॉर एंजाइटी एंड इमोशनल स्ट्रेस के लिए. एक्सपेक्टोरेंट्स यूज किए जाते हैं to remove excessive secretion. Antibiotics use किए जाते हैं किस लिए? To treat the infection. Also, oxygen therapy is given to the patient in case of there is severe distress and the child is having cyanosis. IV fluid therapy is given for the maintenance of fluid electrolyte balance, and comfortable proper position is given to the patient so that the patient get relief from respiratory distress. When this condition, जो भी bronchial asthma है, when it gets worse, or we can say जो severe form of asthma है, that is known as the status asthmaticus. जो status asthmaticus है, ये एक severe form of asthma है. इसमें क्या होता है कि इसमें जब एयरवे ऑब्स्ट्रक्शन होती है and that airway obstruction is unresponsive to usual drug therapy. This is a medical emergency. This one is medical emergency. Status asthmaticus. इसमें क्या हो जाता है, यूजुअली जो ये स्टेटस अस्थमेटिकस है ये एक सीवियर फॉर्म ऑफ अस्थमा होता है और इसमें ज़्यादा होते हैं एस्थमेटिक पैरोस्मस हो जाते हैं, या हम बोल सकते हैं कि जो ये व्हीजिंग होती है, विस्पिंग साउंड होती है, ये कंटिन्यू रहती है फॉर hours to days in spite of administration of bronchodilators. So it is a medical emergency and should be treated with intensive care. मैनेजमेंट जो इसमें है नर्सिंग मैनेजमेंट, दैट इज इम्पोर्टेंट इन ब्रोंकियल अस्थमा. Nursing management. This is important. Nursing care of child. This is important. And nursing care of children with asthma involves skillful assessment and innovative approach to assist the child towards optimal respiratory functioning, growth and development. इसमें नर्सिंग मैनेजमेंट जो है दैट इज टू मच इम्पोर्टेंट. मैनेजमेंट में क्या किया जाता है, जो रेस्पिरेशन पैटर्न है दैट इज जैकेट, सीवियरिटी ऑफ जो अटैक्स होता है एंड जो रेस्पिरेटरी डिस्ट्रेस होता है दैट इज ऑब्जर्व्ड. सीवियरिटी ऑफ अटैक्स एंड द डिग्री ऑफ distress. That should be observed. In nursing management, severity of attacks and degree of respiratory distress should be observed. Another point is the जो breathing pattern होता है, breathing pattern of the child with bronchial asthma, that should be noted. That should be noted for dyspnea and also observed जो ये patient है whether he use करता है accessory respiratory muscles and have nasal flaring. Use of accessory respiratory muscles and nasal flaring. Breathing pattern should be noted for dyspnea and also should be noted accessory respiratory muscles are used and also there is nasal flaring. Another point is the जो child है इसकी anxiety level must be noted. जो children होते हैं इनकी anxiety level जो है that must be noted. Also जो children होते हैं that should be observed for children should be observed for cyanosis. Another point is that when the patients are asleep, they should not be disturbed unless it is necessary. Dehydration in children, there is dehydration that should be treated with adequate fluids. Also, proper breathing habits जो है that should be encouraged. Proper breathing patterns, breathing habits, it should be encouraged. These should be encouraged, such as abdominal breathing, side expansion breathing, forward breathing, and elbow arcing. Forward breathing and also elbow arcing. These should be encouraged. These are the proper breathing patterns. In addition to this, parents are also observed. Parents are advised. Parents जो है that should be advised about development of healthy habits in their children and also advised for the regular follow-ups. This is the nursing management of bronchial asthma, and this concludes the topic.